Around 70 million Americans take blood pressure medication every single day. Every morning, they swallow a pill, check a number on a monitor, and believe they're protecting their heart. But what if the number you've been told to chase is actually making you feel worse? What if the dizziness when you stand up, the afternoon fatigue, the brain fog, the loss of energy you blamed on aging, isn't aging at all? What if it's your blood pressure treatment? Now, before anyone misunderstands me, this video is not about stopping medication. In fact, if you're taking blood pressure medicine, I want you to keep taking it exactly as prescribed until you've spoken with your doctor. But there is something every senior needs to understand, because over the last decade, researchers studying adults over 65 have discovered something surprising. For some older adults, lowering blood pressure too aggressively may create a completely different set of health problems. Falls, fainting, kidney issues, memory problems, even reduced blood flow to the heart itself. And yet millions of seniors have never been told about this risk. I'm Dr. Kang. For years, I've worked with older adults trying to stay healthy, independent, and active after 60. And I keep hearing the same thing. Doctor, my numbers look great, but I don't feel great. Their blood pressure is perfect on paper, yet they feel tired, weak, lightheaded, unsteady, and nobody has connected those symptoms to the medication sitting on their kitchen table. Today, we're going to talk about the blood pressure mistake many seniors make without realizing it. By the end of this video, you'll understand why one blood pressure target does not fit everyone, what happens when blood pressure goes too low, and the simple test every adult over 65 should perform at home this week. Because for some seniors, the goal isn't lower, the goal is safer. Let's begin. There is a particular kind of frustration that many adults experience after 65. Not the kind that sends you to the hospital, not the kind that causes severe symptoms overnight. It's quieter than that. You wake up feeling slightly more tired than you used to. You stand up from a chair and feel unsteady for a moment. Your afternoon energy disappears. You notice yourself moving more slowly, and eventually you start asking the same question many seniors ask. Is this just what getting older feels like? Sometimes it is, but sometimes it isn't. And that's where this conversation becomes important. Because many older adults spend years focusing on a single blood pressure number without ever understanding what that number actually means. Let's start with the basics. Every blood pressure reading contains two numbers. The top number is called systolic pressure. It measures the force against your artery walls when the heart contracts and pushes blood throughout the body. The bottom number is called diastolic pressure. It measures the pressure inside your arteries between heartbeats while the heart is relaxing and refilling. For decades, doctors paid much more attention to the bottom number. In fact, many older medical textbooks considered diastolic pressure the most important measurement. But over time, researchers discovered something unexpected. For adults over 50, the top number often becomes a much stronger predictor of future cardiovascular problems. Heart attacks, heart failure, stroke, and there is a reason for that. As we age, our arteries change. A healthy artery is flexible. It expands slightly with every heartbeat and helps absorb pressure naturally. Think of it like a new garden hose, strong, flexible, resilient. But over the years, arteries gradually become stiffer. Elastic fibers begin to break down. Calcium deposits accumulate. The artery loses some of its ability to stretch. Instead of behaving like a flexible hose, it starts behaving more like a rigid pipe. When that happens, pressure rises much more sharply every time the heart beats, and the systolic number begins climbing. This explains why many older adults develop a pattern known as isolated systolic hypertension. The top number rises, the bottom number stays normal, or even decreases. And here's the important part. This is not the same condition seen in younger adults. The physiology is completely different. Yet for years, many people have been treated using nearly identical targets. And that's where the debate begins. In 2015, one of the most influential blood pressure studies ever conducted, changed the medical world. Researchers followed thousands of adults at increased cardiovascular risk. The goal was simple: determine whether pushing blood pressure lower would improve outcomes. The results seemed impressive. Patients whose systolic pressure was lowered more aggressively experienced fewer heart attacks and fewer major cardiovascular events. Doctors around the world paid attention. Guidelines changed. New targets were introduced. Millions of people were encouraged to lower their blood pressure even further. But there was another side to the story, one that received far less attention. Because the same group that achieved those lower blood pressure numbers also experienced more complications, more dizziness, more fainting episodes, more electrolyte problems, more kidney-related issues. And in older, more vulnerable adults, the balance between benefit and risk became much less clear. That's why many geriatric specialists continue asking an important question: how low is too low? And that question brings us to a patient I'll call Robert. Robert was 73 years old, retired, active, independent. After new treatment goals were introduced, his medication was adjusted to lower his blood pressure further. A few months later, his numbers looked excellent. His doctor was pleased, but Robert wasn't. He felt weaker, more tired, more unsteady. Getting out of a chair became noticeably harder. One morning, he lost his balance while stepping into his garage and fractured his wrist. When his blood pressure was tested while standing, the problem became obvious. His blood pressure dropped dramatically the moment he got to his feet. Sitting down, everything looked perfect. Standing up, his circulation couldn't adapt quickly enough. After adjusting his treatment plan, many of those symptoms improved within weeks. And his response was something I hear surprisingly often: "Doctor, I thought that was just aging." It wasn't. And that's exactly why every senior needs to understand what happens when blood pressure becomes too low. Now let's talk about one of the most overlooked dangers of blood pressure treatment after 65. It's called orthostatic hypotension. The name sounds complicated. The problem is not. It simply means your blood pressure drops too much when you stand up. And for many seniors, it happens every day without them realizing it. Have you ever stood up from a chair and felt dizzy? Ever needed a second to regain your balance? Ever felt a brief wave of weakness after getting out of bed? Most people blame age. Many doctors blame age. But in some cases, blood pressure medication is playing a major role. Here's why. When you're sitting or lying down, gravity isn't working against your circulation very much. The moment you stand, everything changes. Blood naturally shifts downward into the legs. Your body has to react immediately. Blood vessels tighten, your heart adjusts, blood flow to the brain is maintained. In younger adults, this happens almost instantly. But after 65, that response often becomes slower. Blood vessels are less responsive. The nervous system reacts less efficiently. And when blood pressure medications lower resting pressure too aggressively, the body has even less room for error. The result? Blood pressure falls. Blood flow to the brain temporarily drops, and symptoms appear: dizziness, lightheadedness, blurred vision, weakness, unsteadiness, sometimes even fainting. The scary part is what can happen next. Because for older adults, falls are not minor events. A broken wrist can take months to recover from. A hip fracture can completely change someone's independence. I've seen patients who were living active lives 1 month and needed long-term assistance after a single fall the next. And yet many of these patients had excellent blood pressure numbers. That's the paradox. The numbers looked perfect. The person did not. Now I want to explain something called the J-curve. Because this concept completely changes how many specialists think about blood pressure in older adults. Most people assume lower blood pressure is always better. The logic seems obvious. High blood pressure is dangerous. Therefore, lower must be safer. But real-world data doesn't always work that way. When researchers looked at large groups of older adults, they discovered something surprising. As blood pressure falls from very high levels into a healthy range, risk decreases. No surprise there. But once blood pressure drops below a certain point, risk begins rising again. Instead of a straight line, the graph looks like the letter J. Risk is high at the top, lowest in the middle, then begins climbing again at the bottom. One area where this becomes especially important is the lower blood pressure number, the diastolic pressure. Many studies have found that when diastolic pressure falls below roughly 60 to 65, certain risks begin increasing. Between heartbeats, while the heart is resting, the heart muscle itself receives most of its blood supply. That process depends heavily on adequate diastolic pressure. If the pressure becomes too low, blood flow to the heart can be reduced. Think about that for a moment. A treatment designed to protect the cardiovascular system can sometimes lower pressure enough to reduce circulation where it's needed most. This is particularly important for older adults because many already have some degree of narrowing or stiffening in their arteries. The margin for error becomes smaller. And it's not only the heart, the brain is affected too. Several studies have linked excessively low blood pressure in older adults to increased rates of cognitive decline, fatigue, and reduced physical function. That's why the question isn't simply, how low can we go? The better question is, what pressure is safest for this specific person? Because a healthy, active 67-year-old may need a different target than an 82-year-old with balance problems, multiple medications, or a history of falls. And that brings us to the most important question of this entire video. What blood pressure target actually makes sense after age 65? So what should your blood pressure actually be after 65? That's the question millions of seniors ask. And unfortunately, there isn't one perfect number that applies to everyone. Anyone who claims every adult over 65 should have exactly the same blood pressure target is oversimplifying a much more complicated reality, because blood pressure isn't just about age. It's about your overall health, your medications, your kidney function, your risk of falling, your energy levels, your physical activity, and most importantly, how you actually feel. Here's what many geriatric specialists agree on. For adults between 65 and 75 who remain active, independent, and generally healthy, a systolic blood pressure somewhere between 130 and 140 is often considered a reasonable target. Not because lower is impossible, but because this range often provides a good balance between protection and safety. The heart remains protected. The brain continues receiving adequate blood flow, and the risk of treatment-related side effects stays lower. For adults over 75, the conversation often changes, particularly if there are multiple health conditions involved. Balance issues, frailty, memory concerns, kidney disease, a history of falls. In these situations, many specialists become more cautious about aggressively lowering blood pressure. For some individuals, maintaining a systolic pressure closer to 140 or even 150 may actually be the safer option. Not because doctors are giving up, not because treatment doesn't matter, but because medicine should be individualized. The goal isn't achieving a perfect number. The goal is protecting the person, and that's an important distinction. Now let me ask you a question. Do you know what your diastolic pressure usually runs? Most people know the top number. Very few pay attention to the bottom one. But after 65, that lower number may be just as important. If your diastolic pressure is consistently below 65, it's worth discussing with your doctor, especially if you're experiencing fatigue, dizziness, brain fog, weakness, or balance problems. And there's another question almost nobody asks. What happens to your blood pressure when you stand up? Because your seated blood pressure doesn't tell the whole story. A reading taken in a quiet examination room after 5 minutes of rest only captures one moment. Life doesn't happen sitting quietly in a doctor's office. Life happens when you're getting out of bed, walking downstairs, carrying groceries, getting into your car. That's why I encourage every senior to perform a simple home test. Sit quietly for 5 minutes, take your blood pressure, write it down, then stand up. Wait 2 minutes, take it again, compare the numbers. If there's a large drop, bring that information to your doctor. It may reveal something that a routine office visit completely misses. And if you're currently taking blood pressure medication, I want you to start keeping a simple log. Morning, evening, same time each day. Track your readings for 2 weeks. Don't obsess over individual numbers. Look for patterns, because patterns tell the story. One isolated reading means very little. A consistent trend means a lot. When you bring that information to your next appointment, the conversation changes. Instead of guessing, you're working with real data. Instead of reacting to one measurement, you're looking at the bigger picture. And that's exactly how good medical decisions are made. Before we finish, I want you to think about someone. Maybe it's your spouse. Maybe it's a parent. Maybe it's a friend who takes blood pressure medication every morning without ever questioning whether their current targets still make sense. That person needs this information. Because many older adults spend years assuming that feeling tired, dizzy, or mentally foggy is simply part of getting older. Sometimes it is, but sometimes it's not. Sometimes the problem isn't age. Sometimes the problem is that the treatment plan has never been updated to match the reality of an aging body. That's why today's message is so important. Not to stop medications, not to ignore high blood pressure, but to ask better questions, to understand your numbers, to understand your body, and to make sure your treatment is helping you live better, not simply score better on a chart. If this video helped you see blood pressure differently, leave a comment below and tell me your age and your most recent reading. I read every comment, and your experience may help someone else realize they're not alone. Take care of your heart, take care of your brain, and most importantly, take care of yourself. I'll see you in the next video.